Welcome to the Developmental Trauma and Attachment Podcast for Clinicians. Join us today as Josh Carlson, Associate Director of the Knowledge Center, interviews Ceara Alexander, Clinical Supervisor at Chaddock's Special Education School, and gains her insight on working with clients using Chaddock's Developmental Trauma and Attachment Program, or DTAP, lens. The focus of May's podcast is Sympathy and Empathy, where we will be discussing the differences between sympathy and empathy, the impact empathy can have on our clients, and how empathy looks in the therapeutic setting. Welcome to our podcast today, the Developmental Trauma and Attachment podcast and webinar series for clinicians. Today we have Ceara Alexander here with us, and we're going to be talking a little bit about sympathy and empathy in working with kids with trauma and attachment issues. So tell me a little bit about yourself, your role, how long have you been here at Chaddock, and some of the kids that you work with.
Sure. So again, my name is Ceara Alexander. I've been working at Chaddock for about 11 years now. It kind of started off working in the cottages and, went to school, got my master's, and I'm an LCPC now and a certified school counselor. So I've kind of transitioned from cottage work to therapeutically being in the cottages and working with kids and families, primarily high school females. And now I'm at the school as a clinical supervisor, so I supervise all of our school counselors and the therapeutic component of our school. So that's been a nice shift. So I'm not just working with adolescent females, I'm working with, and helping our school team work with kids from kindergarten, all the way up to 12th grade. So that's been very cool, very interesting.
Yeah.
So really getting to see how, our therapeutic model is successful in, a school setting, because I know sometimes a lot of the things that, we do in therapy and in cottages, sometimes doesn't seem like it translates to school. So that's kind of where, my role here at Chaddock and, kind of my experience coming up. So
Yeah. And just to clarify for folks that might be listening to us, when you say cottages, that's our Chaddock's residential program,
Yes.
The Developmental Trauma and Attachment Program. So you used to work residentially with kids who are living here, and now you're in the day school working with kids, both who live here on campus, but then also community students that come just for the day. So what do the terms sympathy and empathy mean to you?
I think for me personally, empathy is really when someone makes a connection with you, not on, a superficial level. Well, they're really able to kind of be in the moment with you and understand, the struggles or joys that you're going through. And sympathy is, really just acknowledging, your care and concern for somebody, but not, maybe having the need for a deeper connection or having that a relationship that requires a lot of connection to heal. So I think, to me, there's positives in both, but I think empathy in particular is one that requires sympathy as well as that deeper level, which is what we usually refer to as empathy.
Sure. So one thing about Chaddock's Developmental Trauma and Attachment Program, it's very relationally focused, and you talked a little bit about how empathy is kind of that deeper relationship piece. Talk a little bit more about why empathy is important in a relational based treatment model.
Well, in the work that we do, here at Chaddock and here at the school, these kids that come from hard places and have the trauma and attachment, they're lacking that ability to make that connection. And so we can have empathy, which means, the common term is putting yourself in somebody's shoes.
Sure.
But it's not only is it that, it's really walking it with them and being there for them with that consistency. We always hear the term, sorry you feel that way. Sometimes, people make those comments, and that's just a very acknowledgement and superficial moving around the issue. But empathy, I think, it's uncomfortable for a lot of people. And these kids have, typically not had anybody sit through the muck with them.
Mm-hmm.
I think they say being in somebody else or being in that person's shoes, it's being in their shoes, whether they're dirty, they're clean, and going through where they've walked. And sometimes it is through the muck and in the mud. And again and again. So it's not just doing it that one time. It's, our kids have their roller coasters, they're up and down. So it's going, having empathy and being with them in their highs and in their lows and, trying to understand, what they're experiencing it goes further than just acknowledging that.
Yeah.
And I think that's really important as staff members and therapists, and working with, and teaching parents how to do those things as well as our staff.
Yeah. Well, I'm glad you mentioned that. It's kind of perfect segue into my next question, which was, it's one thing for a clinician to be mindful about how they're empathically connecting with their client, but we are also charged with how do we help teach others to have empathy for a particular person, whether it be a parent or maybe some other individual or professional that's working with. So maybe it's a teacher, maybe it's a para, in a residential program, a direct care staff. What are maybe we'll focus on the parent piece. In working with parents, how do we instill or help them understand what empathy is and why it's important in relation to interacting with their child?
Well, I think building a connection is, what a lot of our parents long to do. They want, they adopt kids, or maybe they're biological kids where they're just going through things that they've never experienced themselves, or, a lot of our kids who are adopted, we don't really know sometimes at all what they've been through.
Yeah.
So I think in terms of teaching that with parents, it's okay not to know. It's okay to not have actually experienced those things, to still have empathy and be with them. I think a lot of times as adults and kids and even clinicians, we have the tendency to fix, and we have the tendency to say, oh man, that really sucks, I'm really sorry, but let's move on, or let's get past this, let's try and do something different. That's the sympathy piece, and the empathy is just, I keep looking like there's somebody sitting next to me, but just being with them and being like, I know this is really hard, and I don't quite understand yet, but just let me be with you. And it's not always having to talk, it's not always having to try and figure it out. It's just, you're feeling really crappy right now, and I hear that and I see that, and I'm just going to be here with you. And I think, again, parents and adults, especially parents, me being a parent, I really want to help you. I don't know why you're sad.
Right.
And so we have the tendency to talk and get really animated and try to connect, but it's really just allowing them to just sit and be with them. And I think with parents, it's also difficult because a lot of our parents are really far away. How can you do that over the phone and over Skype?
Right.
And so I think it's really, working on the tones and, your cadence, and just help me understand, when you're ready. And showing those concerns more so than talking too much or trying to figure it out. Does that make sense?
Yeah, no. Well, and I think something that you said that was just so profound for me, because we always talk about, therapy isn't about fixing things. It's about how can we decrease the stress, improve functioning, reduce the presenting problems, the frequency, intensity, and duration of the presenting problems that they come to us with. And empathy is such an important piece of the therapeutic relationship, but having empathy for somebody isn't going to fix things. And so often we just want to help, we just want to make things better.
Yeah.
And we miss the boat, maybe as a clinician or
Sure.
the parents that we're working with, we miss the boat because someone's upset or someone's having a struggle, and we just want to help make it better. But that's not what the clinical experience is about, or the clinical process is about. It's how can I use empathy within this clinical setting to facilitate an opportunity for them to explore themselves and create that sense of felt safety.
Yeah.
So for you, when you think about empathy, having that empathic connection, where's the link to felt safety with that?
I think for me, it's hard because it it takes time. And so I think there's time and consistency to really develop that felt safety. And I think sometimes as clinicians and even as parents, and I just think of our school staff, sometimes it doesn't feel like we have a lot of time. And so we want to figure things out. We want to, get to the root of the cause. But sometimes we just have to sit and put up with it and, take the punches as they go, figuratively and,
right.
sometimes seriously thinking. But, there needs to be that consistency. So they know that when I'm having this rough time, that person's going to be there. And if for some reason we can't be there, saying, this is what's going on, I'll, not for being forgotten about. So I think, because we're going to make mistakes, I think me as a clinician, I can count up a list of things I've done that really wasn't the best. But that's okay, as long as we're able to say, wow, I'm sorry, I should have said what I said. Or, you must be going through a really hard time right now. For me to not catch that, I'm sorry.
Right.
And for parents to be okay with that too. Because that also helps with that felt safety. Like, we're gonna screw up. And so if there's a time where you maybe said the wrong thing or did the wrong thing, instead of trying to sugarcoat it or move on from it, acknowledging that's also going to help with that felt safety. Or, wow, you had a really tough time and I'm sorry I didn't get that, or I'm sorry I missed the cues. So I think my really answer to that with how you connect the two is consistency. Is when you have a kid that's going through a hard time, you give them as close to the same responses as you can each time, or the same experience. So they're going to know that, no matter what I do or no matter how the situation arises, mom or dad's going to be there, or, my therapist is going to do the best she can, or parents and teachers and whomever, is that I think consistency is huge. Yeah.
Well, and I think what you said about the consistency piece is so key, and with the felt safety and them just being able to increasing that trust with that client, that no matter what I come to you with, you're going to have that empathic reaction, which is, obviously a huge piece of the therapeutic relationship. So what are some challenges or some barriers that you've experienced as a clinician, or maybe you've seen other clinicians experience in trying to help others understand empathy? Maybe, again, kind of thinking about that parent piece and helping parents hold space to have empathy, to sit in the muck with their child.
Sure. I think the biggest challenge for me is parents, and I would even say just staff too, kind of having their own, I guess you could label it as trauma with the kids, and not just really having the openness, because they've just been through so much with their child where that empathy seems very foreign to them. They just want to say, oh, I'm sorry, because it is so much. And I think that's where, with parents, it is hard, because it's, when I say consistency with, parents and adults and us, they're trying to be consistent for someone who's, no matter how consistent they've appeared to be, they still struggle and they still have issues, or they still have the same, blow-ups or the same things. I think with parents and, just us in general, because we've always have to be aware of what we bring to the table as parents and, people who work here or work with kids. That's where I think that's challenges definitely vary. And I know that's not very specific, but I think in the work that we do, we have kids and families from so many different walks of life that I think, we have to figure out what the parent's been through before maybe we can help them figure out how to be more empathetic. Because I could, lay a blanket statement, but if, you're not sure exactly how, the parent, sees the behavior of the child, that's, I think, a big thing too. So I would say definitely a challenge is, really trying to show, model, and teach that to the parents. I think is the biggest thing for me, because until you're able to figure out with the parents, kind of what their triggers are and what they need, and the challenge definitely is, you're going to have to show that to them. Because I think if they can feel that with you, and, they know that, oh, this is what that feels like, and kind of, hey, when this happened, like, this is how I intervene, or how, I was that piece for you? Do you see, how can this relate to your child?
Yeah.
Which, I mean, I know we talk about that, with staff and, in working directly with the kids, with the teachers, like, show modeling and teaching them is going to be the best way that they're going to learn and see that.
Yeah.
And that comes with things when we make mistakes too.
Yeah.
So when I talked about
Not
acknowledging
being perfect.
them.
Yeah.
Yeah, so I think, does that kind of answer your question in terms of challenges? I kind of feel like it's really...
Well, what I heard, what the theme that I heard is transference and countertransference. Is we have to recognize, especially when we're talking about relationships, and that at Chaddock we talk about that our primary client is the relationship between the parent and child. They each bring their own baggage, so to speak, and as clinicians in that therapy room with them, we bring our own baggage, good and bad. And so how understanding how that baggage plays a role in my interaction with you, and your interaction with me, and your interaction with your child, and my interaction with your child, and vice versa, and all of that is just having a good pulse on where are there opportunities for transference and countertransference to be experienced within that clinical setting, and that when we can acknowledge that and understand that, that we allow opportunity for empathy to grow. Because instead of me focusing on my button being pushed from my past and responding in my present because of something I've experienced in my past, prevents me from being able to have empathy for my child. But if I can understand that that's part of my shark music, that's a button that I'm experiencing, I can set that aside for the moment and say, okay, the feeling that I'm having isn't actually towards my child. What might they be going through? So I think that makes a lot of sense. And I think it's really profound in trauma and attachment work, specifically. And, I know we talk a lot about the importance of recognizing transference and countertransference. I think it's just in clinical work in general, but when you're really specializing in that trauma and attachment piece, there's so much of that can come up for us and not even really realize it. Yeah.
For sure. And I think that's what I love about what we do and what I do is that, every day's a different day. I mean, and every family's so unique. But then what also makes it really tough, because you sometimes, like you said, may be triggered as a clinician or as a parent, and you're like, whoa, where'd that come from?
Right.
So I think, self-reflection in being able to provide that empathy, I think is huge. Yeah.
So how can empathy help our clients in the work we do with them?
It helps, fill those gaps. For me, empathy in working with our kids gives them a different experience, allows them to feel a sense of connection that they may not have had, or a sense of connection on a different level. Because I think, our kids, depending on where they came from, I mean, obviously, most of our kids we work with come from some sort of hard place or have had some sort of, obviously, trauma and attachment. And so I think that empathy piece is great with our kids, because it allows them to rebuild trust. It allows them to, have genuine connection. It allows them to feel cared for, and just looked at as, that there's somebody that's worth caring for. Because a lot of our kids don't feel that, which is, of course, why we see the behaviors that we see. So I definitely think empathy, is a huge piece. It makes us connect on a different type of level than, when they say sympathy versus empathy. Sympathy in the work we do, doesn't build a connection. It just says, sorry, dude, you feel this way, we're moving on. But that empathy really, oh, you understand, or oh, you're not running away from me. You're here with me. That's everybody runs away from me. That's totally different. And like I said, it takes that consistency, because you can have empathy, maybe 4 or 5 times before they recognize what that is. Or they start to feel that, because they're so, obviously our kids are so ingrained in, the negative behaviors, because that gives them, allows them to control their environment, allows them to push people away and not get close. And empathy provides connection and closeness, and that's something that they don't have or know how to do. And so we can show that and, you know, help them transfer that to other adults, whether they be parents, teachers, you know, siblings, and family members. So I think in the work we do, empathy is huge to kind of create that base, so that they know how to make those connections or know how to accept those connections and those relationships as they move forward.
Yeah.
You know, because the kids that we work with, and whether it's residentially or at the school, is just a small part of their life. So we, you know, the biggest impacts we can make with them, and even in a small amount of time is awesome.
Yeah, definitely. Well, and what you were talking really reminds me of the Brene Brown video.
Oh, sure.
We were talking a little bit before we started, in her YouTube video about empathy and sympathy, and she talks about that sympathy drives disconnection and empathy drives connection.
Yeah.
And so when we think about, are we being sympathetic with our clients or empathetic with our clients? It's a huge factor of whether or not we're going to develop a good, strong therapeutic relationship, or a weaker one, dependent upon, are we being sympathetic with our clients or empathetic with their clients?
And I think that's hard, because you know, that video is a great way to explain how sympathy and empathy work with the kids and families that we work with. And I think sometimes, you know, sympathy can get a bad rap, like it's, oh, well, I don't want to be sympathetic because I'm going to foster disconnect.
Right.
Well, it depends on what your goal is. Like,
Absolutely.
you know, if you're working with these kids, empathy is your goal, because you want them to connect and you want to, you know, allow them to transfer that to others and really, you know, feel that. But sympathy is also, you know, you can't have empathy without sympathy.
Right.
So you have to have some sort of, you know, care and concern for them to begin with.
Yeah.
And I think I wish I remember where I read it. I think it was when I was just Googling sympathy versus empathy. Something had came up to where it said, you know, you can't have, if you have empathy without sympathy, something's wrong. So then that kind of reminded me when you talked about countertransference and transference, that to where if you have like loads of empathy, but there isn't a care or concern, you know, that really just made me think, because it's like, well, you can have one without the other, but if you have one and not the other, well, that's interesting, because that makes me think, if you just have empathy, but you don't really have care or concern for that person, that seems a little different.
Right, so it's almost like when we have empathy, it's taking sympathy a little further. So all empathy has sympathy, but not, but sympathy doesn't have empathy. It's one of those.
I wish I could remember. I'm gonna have to go back and look. I just thought it was really interesting. I was like, well, I never thought about it that way. But that did make a little more sense to me, you know, and then kind of help make more sense of the Brene Brown video. It's like, you know, sympathy is showing care and concern, but it's, hey, you know, we're moving on, we got other stuff to do. But, you know, empathy is really, you know, like I said before, jumping down that in the muck with them and just being with them and not having expectations and not having a goal. It's being in that moment. So,
Well, all right. Well, last question.
Sure. One
piece of advice that you might give a clinician in helping teach empathy to a parent or a caregiver?
I would definitely say, kind of like we talked about before, really being aware of what you bring to the table. What makes you comfortable and uncomfortable. Because I definitely think for me, you know, I worked at Chaddock for 11 years and I've had some really strange, uncomfortable situations where, you know, I really had to take a step back and, you know, why can't I do that? And I think being empathetic all the time is hard. So being able to have your own ability to reflect, you know, being able to really understand and know what you bring to the table. And I think the other thing for me would be not being offended and taking things too personally. Because I think there's going to be a lot of times where, you know, I'm being empathetic and kids will still reject you or parents will still be angry with you. And I think those sometimes, depending on where you're at, you know, in your own development with that. So it's just really being self-aware. Self-awareness, I think, is, to me, the biggest, I guess, tip or tool, is just really focusing on, you know, what you do and how you come across, and being okay, being able to accept if you're like, well, I'm doing everything, you know, this said or the book said, but so why are they rejecting me? Right. You know, and so really focusing on those. at least for me, that's where, I've had to do a lot of growing in that. So that's been, I think, the best few suggestions or advice.
Yeah. Again, it's kind of like that. It's not expecting it to always fix things.
Yeah.
And, just because we give someone empathy doesn't mean that it's going to immediately relieve their distress. That's not the point of it. The point of it is finding something inside ourselves that helps us connect with them so that they feel like they're not sitting in the muck alone. Yeah. And that doesn't necessarily make the muck that they're sitting in feel any better or any different, but they know that they have someone who's partnering with them in that experience, and that makes a huge difference. It helps establish that kind of a secure base that there's somebody out there that I can connect with. Yeah.
Very much so.
All right. Well, thank you for joining us today. We really appreciate you sharing your thoughts on sympathy and empathy. And thank you for listening to us today, and hopefully you'll have the opportunity to join us in our webinar later this month on the same topic of empathy and how it's important in the clinical setting and working with trauma and attachment based interventions.